Hey everyone, welcome to this explainer. So today we're diving straight into something I find absolutely fascinating as a doctor: nutritional psychiatry. We're not just talking about general wellness here, the whole eat an apple a day thing. We're going to map out the literal biological journey between what's on your plate and how you feel in your head.
I love to start with this metaphor from Harvard Health because it just hits the nail on the head. Think of your brain as this incredibly expensive, high-performance sports car. It's literally always running, managing your thoughts, your heartbeat, even while you're fast asleep. So naturally, it demands premium fuel. When you give it high-quality nutrition, you're protecting that engine from oxidative stress. But if you're constantly pumping in low-grade fuel, like highly processed junk, well, those inflammatory byproducts actually get trapped inside the brain. And as we'll see, the fallout for your mental health is huge.
Okay, here is our roadmap for today. We're going to cover the gut-brain axis, look at how sugar messes with dopamine, explore the absolute magic of fiber and fermentation, tackle neuroinflammation, and finally, go over some practical clinical interventions.
Let's jump right into Section 1, the gut-brain axis, or as we often call it, the second brain. Now, it's wild to think about, but your gut really does act like a literal second brain. You have this mesh-like network down there called the enteric nervous system, and it uses the exact same neurotransmitters as the brain in your head. Get this, a staggering 90% of your body's serotonin, the stuff that regulates your mood and sleep, and about 50% of your dopamine are manufactured right down in your digestive tract. And the factory workers making all this happen? Your gut microbiota.
So how do these two brains talk to each other? Through the vagus nerve. Picture it like this massive, bidirectional neural superhighway. Signals from your gut are constantly zooming up this nerve, giving your central nervous system real-time updates on what's going on down in your intestines. This specific pathway, the cholinergic anti-inflammatory pathway, actually regulates your emotional and immune responses based directly on your gut's environment. All right, moving into Section 2, sugar, dopamine, and mood. Let's look at the darker side of things. Let's break down exactly what happens during a sugar binge. Literally within 1 minute of eating sugar, bam, your brain gets a massive dopamine spike in the accumbens shell. It's remarkably similar to a pharmacological reward response. But here's where the trap springs. Fast forward to about 30 minutes, chronic sugar intake dangerously delays the release of acetylcholine. That's the chemical that usually taps you on the shoulder and says, hey, we're full now. Because that signal is delayed, you just keep eating or drinking more sugar. It kicks off this vicious cycle of cravings and really desensitizes your reward pathways. And the fallout from all this? A highly processed Western diet literally damages your brain structure. It's not just hijacking your dopamine. This low-grade fuel cranks up oxidative stress, totally messes with your insulin regulation, and drives systemic neuroinflammation. And because it starves out your good gut bacteria, we see a direct clinical correlation between this diet and a much higher risk for anxiety and depression. It's completely throwing off your emotional regulation. So, let's flip the script. Section 3, fiber, fermentation, and the power of SCFAs. This is where we look at the incredible protective power of healthy fiber. The absolute superstars of this section are short-chain fatty acids, or SCFAs for short. These are metabolic byproducts, things like acetate, propanoate, and butyrate. They're created when those healthy gut microbes we talked about ferment the undigested complex carbs and dietary fiber you eat. In nutritional psychiatry, these SCFAs are absolutely essential molecules, and your gut manufactures them entirely out of the fiber you consume. Let's trace this biological pathway, because it's pretty amazing. You eat prebiotic fiber, your gut microbes ferment it, boom, SCFAs are produced. Now, because of their unique structure, these fatty acids slip right into your bloodstream, travel up, and actually cross and fortify your blood-brain barrier. Once they're inside the central nervous system, they act like microscopic security guards, actively shutting down neuroinflammation. So literally, eating fiber directly suppresses inflammation inside your brain. Which naturally brings us to Section 4, neuroinflammation and brain aging. What happens when we starve the brain of these protective inputs? Well, the clinical consequences are pretty severe. If you don't eat fiber, you don't produce SCFAs. That leads straight to a leaky blood-brain barrier and chronic neuroinflammation. But it's not just fiber. If you're deficient in folate or vitamin B12, that can directly trigger depression, psychosis, and completely wreck your concentration. For our older patients, keeping serum B12 levels up is absolutely critical. Deficiencies here are strongly linked to an increased risk of severe delirium and accelerated cognitive decline in Alzheimer's disease. And get this, the power of those SCFAs goes even further than we thought. Researchers are now seeing that increased levels of butyric acid, again, one of those fatty acids from fermented fiber, actually supports the healing of brain tissue after cerebral ischemia. That means we're actively exploring SCFA production right now as a real therapeutic tool to aid in stroke recovery and other traumatic brain injuries. It is literally food acting as medicine.
All right, let's bring it all together in Section 5, Clinical Dietary Interventions. How do we actually put this into practice? If we contrast the standard Western diet with the Mediterranean diet, it's night and day. The Western diet is packed with refined sugars and saturated fats. That's the inflammatory, low-premium fuel. On the flip side, the Mediterranean diet is the ultimate neuroprotective intervention. It's loaded with vegetables, fruits, whole grains, olive oil, and high amounts of fiber, which is exactly what your microbiome needs to pump out those brain-protecting short-chain fatty acids. So, as a doctor, here is my prescription for you. These are practical, everyday swaps. First, ditch the refined carbs and replace them with whole grains. That's an instant fiber boost. Swap out those saturated fats for olive oil and omega-3s. Start eating some fermented foods to naturally restock your gut with probiotics. Make absolutely sure you're getting enough B12 and folate to protect against Alzheimer's risk. Basically, prioritize plant-based, whole foods over anything that comes in a crinkly, processed package.
To put this into perspective, the data on this is just staggering. Studies show that people who stick to traditional dietary patterns like the Mediterranean diet have a 25 to 35% lower risk of depression. Think about that. Your daily food choices are actively managing your anxiety, fighting off depression, and stabilizing your overall mood. It's huge. So I want to leave you with this to chew on. Every single time you eat, you're not just filling your stomach, you're sending chemical instructions directly to your brain. So is your next meal going to be a trigger for oxidative stress and neuroinflammation, or are you going to choose a premium, high-fiber intervention to fortify your blood-brain barrier and elevate your mood? The biology is entirely on your plate. Thank you so much for hanging out and learning with me today. I'll catch you in the next explainer.